Hi, I am Aida Diaz-La Cilento. I am a clinical program director for the Department of Corrections MAT program, and I oversee two prison facilities. So it can impact their mood in a variety of ways. Sometimes it can cause them to be sad or depressed. They might feel lonely, sometimes disconnected, like they don't fit in or withdrawn. That can affect their performances in school or other presentations with their friends. It can also cause, like when they have obesity, an emotional eating disorder. It can cause them to overeat emotionally, and that will also affect the impact of their obesity and their weight. And so, kind of like talking to their pediatrician, or if they're having symptoms of other mental health things, to speak to a professional will be steps in the right direction. It's extremely important to include families in the treatment of the child. First, I would say that it's important to remind the parents that they're the best advocate for their child. They're the ones that know their child best. And so there's a number of treatments that are available for children. And so that might include surgery, medication, like bariatric surgery, and that depends on the child. And obviously the medical provider will be the one to chime in on whether it's appropriate for the child. But a healthy eating, exercise, and diet are probably the most in the first line for children. So vegetables and fruits, movement are probably the best thing that they can do for their child. Yes, so it has been found that Hispanic children actually have been in the highest population of having obesity. And that can be for a number of reasons. It can be the location where they live and the lack of means to what they have for nutrition. It can also be related to the foods that we eat. Being Latina myself, I am quite familiar with, there's a lot of foods that we eat. Rice is a big part of our weekly meals, probably even daily. So the high carbs is not probably the healthiest. During the holidays, there's a lot of fried foods, and even you enjoy those. They're like comfort foods. And so obviously not the healthiest. So not to say that kids can't have those things, but having them in moderation is very important. Obviously, educating the parents on, having rice every day is probably not the best thing, but also kind of like informing the child as well, because it's the child who ultimately is still eating those foods. And if they know that those, extra teaspoons or plates of rice is going to go to their hips and their bellies, they might be a little bit more skeptical about wanting to eat it. Which is why I say in moderation. I'm not suggesting that families don't have those foods. But having them, maybe special occasions or, as a treat once a month rather than, 4 or 5 days a week.